Hi, welcome to our first lesson. So today we're going to talk a little bit about defining social policies and do a quick overview of the first chapter of Janssen's book. So let's start off with looking at, well, what the heck is a social policy anyway, and why the heck does it even matter? Well, we define a social policy as a collective strategies to prevent and address social problems. So really what we're talking about, whenever there's a policy in place, we're trying to fix some sort of social problem. So at the heart of any policy is some sort of problem. And here's the interesting thing about those problems. All of those problems are social constructs, and they only exist because we say they exist. There's no such thing as a social problem unless we say it's a social problem. So, interestingly enough, all of these social policies that we have are based simply on this idea that there's a problem that may or may not exist and may or may not exist many years into the future. In fact, some of these policies move forward with the idea that hopefully some of those problems won't exist. Anyways, here's some quick examples. Constitutions, obviously, are policies. International treaties, public policies, legislation, stated or implied objectives, court decisions, rules, procedures, regulations, all of those things can be considered policies. They don't have to happen at the government level. They can happen at an agency level. They can happen on an individual level with families. I mean, they're everywhere. Anyways, budget and spending priorities are an expression of policy. So what we find is that whenever money is attached to any kind of set of rules or legislation, that is saying that not only are we saying that we want this change to happen, but we are willing to invest a fair amount of money into making sure that it does. So that's an expression of the priorities that a policy has. There are also informal policies and subjective views of persons and groups that influence whether and how to implement specific roles, or specific policies. So why do we have to study this? Well, because our social policies have a huge impact on the way that we live. They are the basis of our rights, our benefits, our opportunities, our services. Without a good knowledge of our policies, we don't necessarily know what all of our rights or benefits or opportunities are. The NASW, or the National Association of Social Workers Code of Ethics, also requires us to be advocates, and social workers should be empowered within each policy sector by developing social work advocacy skills, tools, and interventions. And of course, we'll be covering that this semester. And becoming equipped to respond to core problems at 3 levels for the micro, meso, and macro. So it's really something that really matters to us as social workers. If we want to really help people, we have to acknowledge that whatever is going on inside of their head matters, but what is going on outside of their head also matters. And there could be social problems that simply aren't being addressed appropriately through policy, and that we could alleviate some of that suffering through changing policy. Again, social work code of ethics requires advocacy. Some of the things that are in the NASW code of ethics, I would recommend that you look those up and read them. We want everyone to ensure that they have equal access to resources, employments, opportunities. We want to make sure everyone gets a fair shot. We want to expand choice and opportunity, make sure that people have as many options available to them as possible, promote respect for diversity, safeguard rights, equality, social justice, and prevent and eliminate domination, exploitation, and discrimination. Certainly all things that can and do exist within the context of policy. So, one of the best things that you can do as we move forward into all of this is start to look at what are the values and personal perspectives that you have that are going to inform your way of thinking about policy. All of the different experiences that you have in life, all of the education you've had up to this point, your religious upbringing or lack thereof, your ideology, all of those things are going to influence your perspectives on policy. We'll get more into that into the next chapter, but it's important for you to look at and be aware of what those values are. Um, Understand and work to reduce marginalization. Some people, by way of who designed the policies, unfortunately tends to exclude certain people and put them on the margins of our society where they get less benefits and they're more vulnerable. View social policy from an empowerment perspective so that you can participate in multiple levels. Really, what I want this point to be is for you to feel empowered and know that you have a place within the political system. And you can choose what that place is. You can be an influential person that helps guide society towards something better. Or you could sit on the sidelines and watch other people do it. I know sometimes sitting on the sidelines sounds like it would be less work, but I want you to know, of course, that if you don't stand up and you don't take your place in society, what you will find is that many times you will be governed by your inferiors. And that's not a cool thing to have, because you end up with a system that's all kinds of messed up. You think, why couldn't we have done this simpler and better? Well, largely it was because you didn't do anything about it. So go out and do stuff about things. Look for information, and then look for advocacy groups that are out there to create more just and equitable policies. We're about to talk about the different policy sectors, and each of those sectors have groups within them that are fighting for different kinds of policies within their work, within the certain areas. So be aware of those, and just keep in mind, especially for your project, that you don't have to do this alone. You can go out there. If you have a particular area that you really care about, then you should really look up what other groups in that particular sector are doing and see if you can help out, if you can get on board their bandwagon. Nothing wrong with that. All right, so here's the 8 policy sectors. So these are the different areas of social policies that social workers really care about. It's fairly comprehensive. It covers most of the things and areas where social workers will work. We'll go over them very briefly here. So the first one is child and youth sector. So this would include everything from prevention programs, after school programs, child and family services, child protective services, anything that has to do with children and their well-being would fall under that. The health sector obviously would include things like medical social work, hospitals, clinics, nursing facilities. All of those things matter to us, and they would fall under that in the health sector. Gerontology would also cover things like nursing care, but it includes a lot of policies around end-of-life decisions, things like Social Security, Medicare, and benefits to the elderly. The mental health sector is simply the entire field of mental health services. Everything from your most basic private piddlywink outpatient practice to the state hospital system and everything in between. Education and job development, so this would be kind of like the Department of Workforce Services. How do we help people get jobs? Vocational rehab to help make sure that people that need new skills to get jobs can get those skills. It would also include things like, well, what goes on in elementary and junior high and high schools. All of those things matter and would fall under that section. There's the correction sector. So this is criminal justice, anything that has to do with the legal system, anything that has to do with jails, with courts, with probation, with parole. All of those things are there. Your safety net sector includes things like welfare benefits. How do you make sure that people are getting sufficient medical needs met, their nutritional needs met? Those all fall under there. And then there's the global sector. This is where we deal with issues such as working with refugees, working with immigration, ensuring that people get a fair shot when they come in or out of a country. How do we make sure that social justice is being served on an international scale? So those are the 8 policy sectors. Each of them have their own sets of policies. They all have their own funding sources, their own agencies and programs and literature and controversies. We'll be going over most of them through this course. They all have their own administrative arrangements, ways of selecting and deploying staff, different missions, different subdivisions. So what we will find is that within each of those sectors, there's a lot of differences amongst them, but they do all kind of fall under these distinctive features. So we've already covered a lot of this stuff, so I'm going to skip through it. Feel free to look at these notes. I will post them online. So let's look at policy interventions. So there's 3 levels in which social workers will apply interventions. The micro level focuses on individuals and families and communities, helping them obtain services, benefits, resources, rights, opportunities to which they are entitled and which they might not otherwise obtain. We have a very complex society, and this society in which we live has provided for a lot of services for people. And part of the social worker's job is to provide those services, but also to make sure that those services are being provided under the best conditions possible, typically as defined through policy. So that would be micro-level policy interventions. Meso-level would be changing dysfunctional policies in organizations and communities. This is how we're actually going to change policies, how we're going to make what is written into something different. And then there are our macro-level policies, which is changing dysfunctional policies in court and government settings. Okay, so here's the 7 core problems. These 7 core problems exist in every policy arena. All of these are going to be issues across each of those sectors. I'm going to go through those very quickly as well. We'll be covering these in greater detail throughout the rest of the course. So right now, I want you to just consider this and think of this as an introduction to our framework. So first, advancing ethical rights, human rights, and economic justice. That's going to carry across the different fields. So here are some examples of what that might look like. Meeting basic survival needs, providing persons with opportunities, honoring self-determination, honoring consumers' right to accurate and honest information, etc., etc. So, I mean, those would fit within the mental health system, just as much as they would fit in the gerontology system, just as much as they would fit in criminal justice. Hope that's clear. Okay, improving the quality of social programs. Of course, there are programs in all of these sectors, and we need to make sure that they're effective and that they provide good quality services. How are they being researched? How are they actually solving problems? Are they actually solving problems? Because we might argue that some of them don't. Making social programs and policies more culturally responsive. So how do we deal with people that don't speak English or their English is limited? How do we respect cultural views and values, understanding that many different groups, from the mainstream by literacy level, age, gender, LGBT, persons of different religions, anticipate some healthcare clients will want forms and complementary and alternative medicine, such as herbs, acupuncture, meditation, and yoga. So it's just about how do we make sure that we provide full access to everyone. 4 C's of culture. What do they call the problem? What do they believe the cause of the problem is? How do they cope with the problems? And then what are their concerns about the problem or the condition? Those are just some of the ways that we would define it. All right, moving forward, develop preventative strategies to decrease social problems. So this is where we actually try to prevent problems instead of treating them. Primary prevention is traditional prevention. This is where we want to stop the thing from happening. Secondary prevention aims to identify and treat early, and tertiary prevention aims to identify and treat more advanced problems. Improving affordability and access to social programs. That's exactly what it sounds like. We want to make sure our programs are affordable. Increase the scope and effectiveness of mental health programs, because mental health, while it is its own sector, also cuts across the